What are teeth and how do cavities on teeth even develop? What are the necessary factors that must be present for a dental cavity to form? And number three, what is teeth sensitivity and how do we even get it or how does it develop? I'm Dr. Mo and I'm a doctor of dental surgery. Don't forget to support the channel by leaving a like and a comment. So, a tooth is divided into two predominant portions. One that is visible and that is called a crown and a root. Okay, the crown is divided into three main layers: the enamel, the dentin or the body, and the pulp, whereas the root is formed of the cementum, the dentin, and the pulp or the nerve. Actually, it's not only the nerve, there are other components of the pulp, such as vascular tissues and liquids there. So dental cavity, for a dental cavity to form, it starts as something called as the dental caries. And for dental caries to exist, we need bacteria, something for the bacteria to feed on, for example, sugar, and number three, time. Time for the bacteria to consume this sugar and have a waste product which breaks down that external layer of the tooth, for example, that's called the enamel, to start developing a cavity. What is tooth sensitivity? It occurs when the underlying layer, i.e., the dentin, is exposed because the enamel surprisingly has no sensations, not feel, or the cementum, which is the external layer of the root, is exposed. That's why in gum recession patients, they suffer from sensitivity. Thank you for watching. Make sure to like and share this video.